10 to 6 and I'm making my drive into the hospital. That's probably going to vary for a lot of you depending on what hospital you're at, what rotation you're in, your chief resident, your attendings, lots of different variables. So it's really kind of hard to say when exactly you're gonna start your day. But the key is that you need to find out what you need to do at the hospital, what your responsibilities are as a student, and you need to make sure that you get there and get them done before the more important people start showing up. So the first thing is rounding and pre-rounding, and basically that just means going around and rounding and seeing all of your patients, checking in with them, see how they're doing, checking for their inputs and outputs, meaning fluids, like what did they receive, how much did they output, did anything happen over the night, did something crazy happen and you know that the attending needs to be aware of. The person coded in the middle of the night or something like that happened. So rounds usually happen with the attending or with the chief resident. So if they expect you to pre-round, that means that you as the medical student needs to get there beforehand to be able to walk around, say hello to your patients, see how they're doing, check with the nurses, and all that kind of stuff. The next thing, and again this may vary, is called sign out. Sign out basically is where the night team signs out the patients to the morning team. They tell them everything that happened, what the plan is, how to go about achieving that plan, and all that kind of stuff. And so usually you get there, you pre-round, you meet up, you do sign out, and then you go on actual rounds and see your patients. And then depending on what service you're on will kind of vary. For the most part, you know, that's what you're gonna do. You know, as far as for today, I'm gonna vlog in the morning. I'll talk to you guys, you know, before I head into the hospital. And then I'll pick back up after I get out, because obviously recording in the hospital is kind of frowned upon. So you'll kind of find that, you know, at the hospital that you're at and with the residents that you're working with or the attendings that you're working with, that things are gonna go a little bit different. So everything kind of varies for person to person and for rotation to rotation. And so that's kind of, I'm just giving you the general layout of what you can kind of expect, and maybe give you a way that you can be better prepared when you get here and when you do this stuff. The only thing that probably stays constant is that you need coffee. That's probably number one.
I've been chased. Maybe I just knew I had to wait for you. Draw a knife and carve a little space for you. It feels nice.
So I was just trying to think of some things of, you know, what it was like for me on my first day of clinicals, and try to think of some things that might be useful for you to do. So the first thing I could say is make sure on your first day when you're starting, you wake up early. Get there early, and kind of, if you have an orientation, they'll be able to show you where in the hospital kind of you're gonna be. You know, so you can get to your floor, you can kind of walk around, you can introduce yourself to people who you're going to be working with and who are going to be helping you for the most part. Primarily, that will be all of the nurses, medical assistants, I should say. Obviously, hopefully you'll know the other medical students, but for the most part, it'll be like your nurses, it'll be, you know, everybody that's on the floor, some of your social workers, those types of people. And make sure that you say hello to them, you chat with them, you introduce yourself, you say, hey, I'm the medical student, you know, be polite, befriend all of these people, because they're going to be the ones that know where everything is. So when your resident turns to you and says, hey, go get me an NG tube, you know, you're going to say, you might say, what the heck is an NG tube? Which is totally reasonable if you've never heard that expression before. Or you may say, okay, I know what an NG tube looks like, but I have absolutely no idea where to go and find it, which is, again, totally reasonable.
I make my own rules in my own plans. I got no room for no man. That's my way. That's my way. But then I saw you in a dream, right? I wanna call you a kind of.
It's about 5:30 and just getting out and about to start making the trek home. So now I gotta try to find my car. It's not on that floor. It is absolutely freezing in New York City today. My car says that it's 37 degrees, but I feel like there's absolutely no way that that's what it is, because it's frigid. So today is actually a really odd day in the schedule, and it wasn't like a typical day. So what I'm going to do is I'm going to tell you kind of how my day went today, and then I'm going to talk about what a typical day is like by comparison. I got to the hospital, and we went and we rounded on our patients, and checked in on everybody, and then immediately after we went to the conference hall for the Morbidity and Mortality Conference, and then we had a lecture from a physician from Africa on eclampsia. So eclampsia, not very common in the United States, but eclampsia is very common in Africa. We also then went back to the residence room where we had a lecture, kind of a lecture, it's kind of like more of a presentation on utilizing IV NSAIDs after surgeries to try to reduce the amount of opiates that are being used. So that was pretty interesting. And then after that, we had a lecture from one of the interventional radiologists in the hospital about the indications for uterine artery embolization in the treatment of fibroids. But today was a different day. Today was not a typical day. Typically we're not in lectures like that all day. But today was just, odd, not normal. Typically, right after you go on your rounds with your residents, you'll then head to either procedures or kind of taking care of and seeing the patient. So during rounds, things will be pointed out. This person needs an incentive spirometer. This person needs their dressing changed. This person needs an ABG done. And you'll make like a short list of things that you need to accomplish, and then you'll go around either with the resident or by yourself to do some of these things, and kind of cross things off as you go. And that will take you probably through most of the afternoon. You will also split your time kind of bouncing between seeing patients in the hospital and then also tending to some of the outpatient clinics that the residents have to cover. So depending on what you're on. I was on GYN. There were no procedures today, so I did not have any procedures to cover. So pretty much I was in lectures for most of the day, covering the topics that we just spoke about. So really, I think the biggest difference in overall between your preclinical years or your basic science years, I guess, and your clinical years is in your basic science years, you're given a schedule. You're told, when to be at lecture, when your tests are going to be. You have a basic timeline of when you have to, get things done. Your clinical years is kind of like that. You know when your shelf exam is going to be at the end of every rotation. You know when your evaluations are due, which obviously is important. But it's not as organized, and every day is a little bit different. I mean, today was a complete curveball. I totally did not know that it was a lecture day. I showed up thinking that I was going to be in surgical procedures all day, and lo and behold, I was in lectures all day. I didn't see a single procedure. You're responsible for determining when to study. You're responsible for what types of things you devote your time to and how you compartmentalize your day. it's all up to you. And really, I mean, you can go days without touching a book if you don't want to. You could do practice questions the whole time. No one is watching over you, and I think that's, you know, probably the biggest struggle that I've seen so far is the new students who are coming in recently have had a little bit more trouble with dealing with the lack of structure. So on top of dealing with learning the hospital and learning where things are and how to go about doing things and all that kind of stuff, on top of that, then they're also dealing with figuring out and trying to navigate this new system of what they're supposed to actually be doing. The best thing I could say is pick a review source, something to use, and just find that resource, whatever your resource is going to be, and then just bang it out and use that. Read when you're not doing things, find ways to occupy your time, go and see patients, go and, you know, look up lab values and see what's happening with the patients. That's going to be your best bet. But really, I mean, that's the biggest thing, that's the biggest difference, is making that transition from having your day completely planned out to having nothing, no instruction whatsoever. You kind of just make it what you want. And you can make good use of your time, like the things we just talked about, and you could make bad use of your time, sitting in the residence room or hiding in, you know, a not busy area of the hospital. It's honestly completely up to you, but I think you can figure out just from what I'm telling you what, you know, what the recommended way to go is. So it's about 10:30. After making the drive home, I came home, decompressed a little while, ate a snack, watched some YouTube videos, and then got right to studying. I, you know, kind of watched some videos, took some notes, did some questions, worked on my personal statement for residency application, caught up on some emails, looked over some stuff for some research that I'm doing, and all of that kind of took me all the way up until a little while ago. My girlfriend came home, we ate some dinner, and now I'm ready to go to bed, wake up tomorrow, and pretty much do it all over again, starting from scratch. 5:30 a.m., coffee in me, getting ready to get there for rounds. Actually, I have to get there a little bit earlier tomorrow. I think rounds are starting at like 6 because we have a new chief. So that's pretty much how the day goes. That's pretty much what you can expect for clinic. We hope that that kind of helps you, gives you a little bit more guidance as to what you're going to be doing. Yeah, so let us know what your questions are, concerns, things that you see. Make sure you check us out on abilityscience.org, and also follow us on Twitter at abilityscience, like us on Facebook, and stay tuned next week for a new episode of the vlog where we tackle some more topics. So post any questions that you guys have about some different things, and hopefully we can get you some answers for those. Take care, and I will see you guys again soon.